Hello, this is Crystal Meach with Dow of the Heart, and today I have Rachel Lank from Florida Gutz Coaching. And like I always do, I'm just going to dive in and ask, how did you come up with Florida Gutz Coaching?
Well, hi, Crystal. I'm so glad to be here. Thank you so much for inviting me. It's an honor to be here as one of your guests.
Thank you.
And how did I start? Yeah, you're welcome. How did I start Florida Gutz Coaching? Well, the story starts, I won't go all the way back, but really it started with me finding a new lifestyle and to cure, take away all of my gut issues. I suffered for years with abdominal pain, abdominal bloat, indigestion, all these other symptoms. And a few years back, I was able to let go of taking the prescription medications that was given to me by the doctor, and also, multiple tests after test, and abdominal pain of on a scale of 1 to 10, with 10 being severe, at about a 7 most every day of the week. So I found it through,
Wow.
holistic, simple lifestyle and diet changes. And Florida Gutz Coaching kind of birthed out of that. And I can get into the backstory a little bit more, but it birthed out of that because, I thought, well, wow, I know, because I'm doing there, but I know there was other people out there like me who had been suffering for years and didn't know, because you don't know what you don't know. That was me. Right. And still I started exploring.
Yeah.
And Florida Gutz Coaching came out of wanting to help all those who are suffering in silence. And they just don't know that there's a new way out there where they can let go of expensive medications and just live their life pretty much bloat free. And it depends on if you're on vacation and you get off track, right? But you'll do live life. And
Sure.
yeah, that's how it was birthed. So that was birthed in 2021. So, and if I may, I'll go ahead
Okay.
and tell a little bit of the backstory to how that got Florida Gutz Coaching. So
Yeah.
I've always had a passion for health and the body. And I apologize, you may hear my dog in the background, but I didn't have anywhere else to put him, so it's good. And anyway, I've always had a
That's okay.
passion for the health of the body and things like that, and was always interested. All of my science fair projects in, middle school, and was like on the muscles, on the skin, on the digestive organs. It was all that stuff. So it started a long time ago, but then I became a registered nurse, right after high school, went to school for that. And so I've been a registered nurse for just over 30 years, and did a variety of things. But the last 15 of my clinical nursing years, like in the hospital and the office setting, uh, and up until now, has been in the digestive issues arena. So for over 10 years, I worked for a gastroenterology office in town. And that's an office that, with digestive issues, you go to them because you're having heartburn or you need your colonoscopy. I used to, you become of age and you need your colonoscopy is what I used to tell my patients. But anyway, the common denominator
That's fun.
of all the digestive issues, yeah. The common denominator of all the digestive issues, because I've saw, so many, because there's so many out there, was bloating. And bloating just, made people feel blah. And actually, while I was a nurse, I suffered for many years, like I said, and even while this stuff started happening back in my 20s, but fast forward many, many years into the digestive issue clinic that I worked in, I was still having these issues and being treated by my own gastroenterologist. And some days I would feel good, and some days I would feel not so good, even taking the medications. But when I just felt like crap, it affected my whole life. I didn't want to go out. I didn't want to do anything. I felt lazy. I just, it just really affected. And then sometimes I would just have to push on, even though I'm so uncomfortable. Sorry about that. Sorry. You want me to stop there?
No,
No.
it's okay.
We'll keep going. There you go. There you go. Mailman, Amazon person's probably there.
We can edit.
One moment.
We'll just edit it out.
Okay.
Yeah.
Okay. Very good. Thank you. So I put him up, then he'll scratch at the door. So
Gotta love Amazon.
Yeah, he's protecting his mama. So that's
Sure.
how it came about, that I realized that so many people did suffer with bloat, and maybe they had other digestive issues too, but bloat was the common denominator. And I really don't want, and I focus on women, but men do come to me too as clients, and I'm open to that. But men don't talk about their bloat too much, and women, it's more of a common thing for women to perhaps, it's more common in women. Actually, in 1 in 10 people, 1 in 10 women have bloat, suffer from bloat more than once a week. So that's how the coaching came about. I went to, in 2021, became a certified health and life coach. And then, after I completed that course, I started Florida Gutz, and, was taking clients even as a student, and really seeing positive results in those clients. And so, that's the story. And the reason I'm also certified in life coaching is because when you have health issues, you normally have life issues.
So
when you have life issues, you have health issues. Yeah. So that was about it. Yeah.
yeah, it's so true. Like it affects your whole life. It does.
Right. It
Health is
does.
wealth.
I have a little saying, health is wealth, right? When it's this energy that you give off, if your stomach is hurting, you're feeling tight in all your skin, you're giving off this energy that most of the time you're giving off this energy that others can see, even though you're trying to hold, maybe not be like that. But yes, you help when you have health issues, normally have life issues. And life and health issues too. And so as a client that you get to work with me, you may be working on, your health, but we're also working on life issues at the same time. So that's how that.
So if someone is interested, like who usually comes to you? Like, how do you find clients? Is it usually like your former, when you were a nurse, or you get like a referral, or how does that work?
Oh, good question. So clients come to me through word of mouth. It's very good. Maybe one of my past clients, said, you got to check this out. If you're suffering for this,
Okay.
go see Rachel. Through referrals then as well. Through events, I have something called the Gutsy Show with Coach Rachel. I do a Facebook Live once a month, and they may not even have been at the live event. However, they see it and go, oh, she's speaking to me, and they'll reach out that way. Businesses as well, and just out in the community, is getting the name out there.
Sure.
And I do community events where I teach on certain health topics as well. So I get clients that way. And then there's Facebook and social media where they see.
Sure. And then like when someone comes to you, how does that work? Like, do they just like have a consultation and then you decide their goals, or what usually happens?
So they will reach out to me, and then we can set up a discovery call, which is, a free consultation. And during that discovery call, we find out what their health goals are, and maybe some life goals. It's so funny that all the clients have had life goals as well. And it's, like I said, it just goes hand in hand. And then I ask them a series of questions. And then, they figure out, is this a good fit, if we are a good fit for each other, and if this is a right time for them. But yes, just basically taking them through the discovery call, discovering what they would like to achieve and where they want to go from there. And then after that discovery call, when they decide to work, when we decide to work together, it's one-to-one, weekly. Some clients like to do every other week, 1 hour sessions, private. It's one-to-one coaching, and it's a 12-week program. So if, the client wants to do it weekly, which is good, it just depends on their schedule. And, then it's a 3-month, but if they would like to do it every other week, then it, turns into a 6-month program. But yes, it's a 1 hour, and we just go through, what their goals are, and they really have the answers inside themselves. And just, they need somebody who helps them be accountable and maybe sees a different picture than they see, because when we're standing in our own selves, it's hard to see, a resolution.
Sure.
So,
Yeah. And I think it's so fascinating because you have, it sounds like a wide array of clients. It's not just like for people that have like a chronic disease. It's like everyday clients, people that just have bloat or they don't necessarily have a diagnosis. So,
you are,
could you maybe
mm-hmm.
could you maybe speak to that? Like,
Oh, certainly, very well. So I am not a doctor, even though, I'm a registered nurse, and when you work with me, you get all of that knowledge of the medical field, plus the 15 years of being in the digestive issues arena. But the clients who generally come to me, like I did, my self-discovery is they have been worked up by the doctors. They've had the appointments, been worked up, had the medications, took the CAT scans, took the tests, upper endoscopies, or maybe a breath test, even a colonoscopy. They have been worked up and labs as well, spent a lot of money, all to be told that they're normal. And here, this medication will help you. Now, I have a lot of respect for doctors, and there is a place. And so I always tell clients, please collaborate with your doctor, because, if you're on certain medications, please check with them to make sure that this is going to work, or because I do suggest supplements as well. But I always have them collaborate with their doctors. So, but yes, the clients come to me because they are sick and tired of being sick and tired, even though they've been to the doctors. And they would like to conquer that bloat. They want to feel better. However, on that note that you said, I have several clients that came to me because they have heartburn, and within just a few sessions and the techniques that I help them with, that we guide them through, they report that, it's either cut in half or it's gone, so we just keep practicing that. And then the other goals that they have on their journey with me. So on our journey together.
yeah, that's interesting that you say that, like heartburn. Like, there's so many issues that you don't necessarily think relate to your gut, and yet they do totally relate to the gut. So maybe you could speak a little bit more to that.
Mm-hmm. Oh, absolutely. And, the gut is called the second brain, right? Because uh, it's really, besides the brain, it's like the epicenter of the body. There is the vagus nerve that runs from here to here. And if you imagine your major highway in the town that you live in, that's it. Boom, boom. And it keeps communicating with each other. And, with that being said, so like stress affects the gut, as most people probably know, but some don't know. And some of the reasons why I had all those symptoms, because I was having a very stressful time in my life, with different things that I had going on. So that contributed to my gut issues. I did end up having a diagnosis as well that went with my gut issues. So, but yes, heartburn, you can have nausea. You could have, alternate between either constipation or diarrhea, and I've had many patients who they had to live by where the bathroom was, and those are things I can help with too, just through simple diet, where you can maybe perhaps get out away from taking your medications, or at least, decrease those amount. And the other thing too is the gut, your gut health affects your, of course, your mood and your skin, what you feed it, reflection of your skin, even your anxiety, if you're an anxious person, or depression. It's been linked to, ADHD, how you take care of your gut as well. So in the program, when I'm helping a client, I'm helping them conquer their bloat or conquer their heartburn or get their digestive issues straightened out, whether it even, be with their bowels, they're going to get their gut well. And getting your gut well is the key to optimal health, because it's just, like I said, your gut just affects everything. And normally, if you can get your gut well, it's going to decrease inflammation throughout the rest of your body. And inflammation is the root cause of most diseases. So to teach people, or to teach clients how to treat their gut nicely, will improve, their diabetes, their heart disease, their cholesterol levels, their skin, their mood, and then the list just goes on and on. So it's very exciting. I love to share about that.
And yeah, that's interesting. And I've heard before that you store emotions in your gut. Is that true?
Yes, it is true. So, that saying, got that gut feeling, and that is because of the nerve that's connected. It directly is connected. When you get that gut feeling, it's because your brain is sending those nerve signals of emotions, per se, down to your gut, and vice versa. And I had a mentor tell me one time, this is even before I got into coaching, Rachel, your gut never lies. So
yeah, I mean,
it is true. Your gut never lies. Listen to your gut.
You think of like your mind, which is all logic and reason, and then your heart is all emotion. You can be blinded by love. Mm-hmm. And then, like you said, the gut doesn't lie.
The gut doesn't lie. It's
I love
like
that.
a combination of both.
Yeah.
Combination, right?
Yeah. Can you explain a little bit more about like diet in the gut and how you potentially help clients?
Yes. So when I say getting your gut well, and it will conquer their bloat, and again, that's my niche, helping women over 40 plus conquer their abdominal bloat, slim their waistline. But again, I do take men. But the diet. So your gut has these microbiome in it, and that's probably like a buzzword that we hear a lot. But basically, what that is, in more simple terms, is the good and bad bacteria in your gut. And there's millions and millions of this bacteria in your gut, and they feed on what you feed it. And the ratio you would like to have in your gut is more good bacteria, and there's really not, it's all called microbiome, and literally it's called good bacteria and bad bacteria. And it's a very simple term. The good bacteria makes you feel good, right? And then the bad bacteria will make you feel crappy. So when you eat junk, high processed, high carbohydrate foods, greasy, a lot of high saturated fat foods, and candy, and, just think sugar. The bad bacteria in your gut love that. And so when you keep feeding it, it says, okay, give me more. So you literally crave more. That's why these cravings are so strong, because the more you feed yourself these foods, the bad bacteria, I've said it before, like having a party in there. They're just having a party. Oh my gosh, this is so exciting. And so they invite all the neighborhood. Okay. And they crowd out the good bacteria and they go, get out of here. You're a party pooper. And literally, right? And
Yeah.
so the bacteria take over and you become bloated. You start with indigestion. You feel tight in your skin. Your mood is down. You may find that you have sleep disturbances even, or, your brain fog going on and all sorts of things. But in the program, what I do is I help clients start. It's simple. It's not like a total, okay, you got to do this. I work where the client is. And, we gradually start introducing water is actually the first thing because most people don't drink enough water. And so get them to increase their water intake. That's a real baby step that they take, but they'll find so much relief just from doing that. Even if, because I'll be honest with you too, I sometimes have clients come to me for anxiety, and lo and behold, their gut health is not so well. So I'll start, we work on the life issues, and then I work on the gut issues as well with them, and then we start introducing, okay, what are you eating during a day, and we'll look at that. And so if it's not foods that it benefits the good bacteria, I'll have them start replacing meals, be it one meal a day with more whole foods, and they'll pick out what they like. Tell me about what kind of food you like to eat that's on this list. And so they pick out their own menu and then they plan it out. And so it makes them feel very empowered, and it just becomes who they are. That's the whole goal, is these new habits that they're creating for themselves. It becomes who they are. So as the program goes on, they start including more and more healthier whole foods, and the junk food per se, quote unquote, goes away. So the gut bacteria gets more into ratio. So they start feeling better. They start feeling better because they're making these healthy choices. They're proud of themselves for doing that, and they should very well be. Then we start to incorporate movement, regardless, as if, some people like to exercise, but just depend on where they are with that. But movement is great for digestive as well, especially for constipation, but also for, decreasing bloat, because as you move around, it helps to decrease the gas in your stomach. And getting outside for a walk is great for the mind, with that gut brain connection. And exercise is shown to really increase, your mood. But in the same time, because of that gut brain connection, you're making your gut very happy when you do it as well. So, and then
Awesome.
we'll round it out too with different. I look at their sleep, how what their sleep patterns are like, and we start improving on that. Most of the time, it's we're so busy in life that everybody could use improvement in sleep, and
Yeah.
and then also how they talk to themselves, and how they treat themselves internally. And so we look at that and just help them, look at themselves in a way that's uplifting versus, oh, I just never get it right, So it's
Sure.
very empowering. Yeah.
Wow. Well, that is awesome.
Thank
Thank
you.
you so
Yeah, it's a
much.
joy.
Yeah,
You're
and
welcome.
I'll certainly put. Is there anything else you wanted to share?
Well, let's see. I think we covered it a lot, but I will just say this too. Remember, gut health is the key to optimal health. So getting your gut well, that's my little tagline. If somebody is watching this, and not everybody likes to talk about their digestive issues, but I will say I love to talk about it, and everything you say to me is confidential. So, during our coaching, and just it's sometimes, it's a little embarrassing to talk about what's going on, but just know that I've heard it all. It's okay. I love to talk about it, and I'm here to help you. So, if that makes
Yeah,
anybody
that's so
feel a
important
little
to have
more at
trust
ease.
and
Yes, just to know that, it's a non-judgmental place. I've been in their shoes, And I've seen many of patients in their shoes and helped the patients through, with their journey too, via the medical side. So, yeah. And if you are looking to find me, you can find me on www.floridaguts.com. That's FLGUTZ.com. That's my website. And you can also find that, on Facebook, or Instagram is at Rachel Lank. And then I'm on LinkedIn as well at Rachel Lank, my name. So it's been a pleasure.
And we'll add your information to the description box. But yes, it has been a pleasure. Thank you so much for coming on, and I'd love to have you on again sometime.
Oh, I'd love to. Yes, it's been an honor. So, yeah. Do you have any other questions for me, Crystal?
No, I think we're going to wrap it up. Thank you so much. And yeah, find her information in the description box below, and we'll see you next time. Thanks.
All right. Bye-bye.